Class 1 antiarrhythmic drugs. Class 1 drugs are act by blocking voltage sensitive sodium channels. They bind more rapidly to open or inactivated sodium channels than to the channels that are fully repolarized. Sodium channel blockers have declined due to their pro-arrhythmic activity. Class 1A drugs are further divided into 1A antiarrhythmic drugs. 1A, you have to remember QPD, short form. Quinidine, procainamide and disopyramide. Mechanism of action: they open the inactivated sodium channels and prevent the sodium influx, thus slowing the rapid upstroke of during phase 0. It decreases the slope of phase 4 spontaneous depolarization, inhibits potassium channels and blocks calcium channels. Because of these actions, slows conduction velocity, increases the refractoriness. Quinidine has mild alpha-adrenergic blocking and anticholinergic actions. Procainamide and disopyramide have similar actions to those of quinidine, but there is less anticholinergic activity. Class 1A drugs will slow phase 0 repolarization. In addition, because of their class 3 activity, these drugs prolong the action potential. You can see here quinidine, procainamide and disopyramide, they block open or inactivated sodium channels. These drugs have an intermediate or slow rate of association with sodium channels. Now, therapeutic uses. Quinidine is used in the treatment of arrhythmias, including atrial, AV, junctional, ventricular tachyarrhythmias. Procainamide is the only IV formulation available to be used to acute atrial and ventricular arrhythmias. Disopyramide can be used as an alternative treatment for ventricular arrhythmias. Pharmacokinetics: quinidine sulfate or gluconate is rapidly and well absorbed. It undergoes extensive metabolism by hepatic CYP450 system. A portion of procainamide is acylated to NAPA, which has properties adverse effect of class 3 drugs. Adverse effect: they have the ability to worsen the heart failure symptom. Class 1A drugs should not be used in patients with atherosclerosis, heart disease or systolic heart failure. Class 1B drugs are lidocaine and mexiletine. Now, mechanism of action is, in addition to sodium blockade, they shorten the phase 3 repolarization and decrease the duration of action potential. See, phase 3 and decrease the duration of action potential. Lidocaine and mexiletine block open or inactive sodium channel. These drugs have rapid rate of association with sodium channels, unlike class 1A. Now, amiodarone. Amiodarone is a drug of choice for ventricular fibrillation of ventricular tachycardia. Lidocaine may be used as an alternative. Lidocaine may also be used in combination. Mexiletine is used in chronic treatment of ventricular arrhythmias or in combination with amiodarone. Pharmacokinetics: they are given IV. Extensive first pass metabolism. Mexiletine is well absorbed oral and it is metabolized in liver. Adverse effects: wide therapeutic index. So CNS effects include nystagmus, drowsiness, slurred speech, paresthesia, agitation, confusion. Mexiletine narrow therapeutic index should be used in caution with CYP2D6 inhibitors, nausea, vomiting, dyspepsia. Now, class 1C antiarrhythmic are flecainide and propafenone. These are class 1C. These drugs slowly dissociate from resting sodium channels and show prominent effects even at normal heart rates. Mechanism of action: flecainide suppresses phase 0 upstroke in Purkinje and myocardial fibrils. This causes marked slowing of conduction in all the cardiac tissues with a minor effect on duration of action potential. Refractoriness: automaticity is reduced by an increase in the threshold potential rather than decrease in the slope of phase 4 depolarization. So, flecainamide will also block potassium, leading to increased duration of action potential. Propafenone, like flecainamide, slows conduction in all cardiac tissue but does not block potassium channels. Now, phase 1C markedly slow phase 0 depolarization, you see here, and they also do the same, but these have slow rate of association like 1A. Therapeutic uses: maintenance of sinus rhythm in atrial flutter or fibrillation, without structural heart disease and in treating refractory ventricular arrhythmias. Propafenone is restricted mostly to atrial arrhythmias, rhythm control of atrial fibrillation or flutter. Pharmacokinetics, they are absorbed orally, metabolized by CYP2D6. Propafenone is metabolized by active primarily by CYP2D6. Adverse effects, well tolerated with blurred vision, dizziness, nausea are most common. Now class 2 antiarrhythmic drugs. Class 2 are beta-adrenergic antagonists or beta blockers. These drugs diminish phase 4 depolarization and they depress automaticity, prolong AV conduction, decreases heart rate and contractility. They are useful in treating tachyarrhythmias, increase sympathetic activity. They are also used for atrial flutter and fibrillation and for AV nodal reentrant tachycardia. Metoprolol is widely used for treatment of cardiac arrhythmias compared to non-selective beta blockers such as propranolol. It reduces the risk of bronchospasm. It is extensively metabolized by CYP2D6. Esmolol is very short and fast acting. IV in acute arrhythmia, surgery or emergency situation. Esmolol is rapidly metabolized by esterases.